Hi everybody, welcome to our latest community conversation. My name is Luke Margolis. I'm the Corporate Communications Director for Atlantic Health System, and I'm excited today to be joined by Atlantic Health System's Dr. Christopher Zipp. He is the chair of the Department of Family Medicine at Morristown Medical Center and a physician with Atlantic Medical Group. Dr. Zipp, thanks for joining us today.
Thank you for having me.
So today we're going to have a wide-ranging conversation on a very timely issue, and that, of course, as the weather begins to warm up, is summer safety. We're also going to talk about a number of ways that family medicine and the fight against COVID have sort of intertwined over the last few months. And so, Dr. Zipp, if you'll indulge me for 1 minute, I just want to give a little bit of lay of the land for how this is going to work for folks who may not have seen one of our community conversations before. Dr. Zipp and I are going to chat for about half an hour. It will appear live as you're seeing it on Facebook now. It will also appear on LinkedIn and on our YouTube channel. So you can, if you miss any portion of it today, you can catch it there. If you prefer to watch these kinds of things on television, News 12 Plus is a new opportunity for viewers to watch there as well on weekends, Saturday and Sunday from 8:30 to 9. So there's a couple of different ways to see this, but we have a limited amount of time today, and we want to try to involve some feedback from our audience if we can throughout. So if you're ready, Dr. Zipp, let's jump right into it.
Sure thing.
Okay, so I think that everybody could be kind of forgiven for forgetting that as we've fought with COVID, the rest of the illnesses and conditions and things that people deal with regularly still continue unabated, right? And summer safety is an opportunity for us to be outside and to enjoy the nice weather, but it comes with it some health challenges as well. And with your position as an expert in family medicine, I'm wondering, let's break down some of the big ones.
Sure.
And if there's, I was thinking maybe we could start with something like skincare and then kind of go from there. But if you think there's one or two that definitely rise to the top above them all, I'll defer to your expertise.
Sure thing, Luke. One thing that everybody knows about is to wear sunblock.
Sure.
And this comes up all the time. We get a lot of questions about this in our practice. And pretty much everybody knows that a child younger than 6 months just shouldn't be exposed to the sun. Right. Keep them in the shade, keep them cool with cool clothing that will keep them sun protected.
Hats.
Yes, and a large hat, not just a baseball cap, and this goes for all of us, a hat that will cover your ears, your neck, and shade you. Now, once we get past the 6-month mark, then we start to use sunblock. One of the things that most people forget is you have to put sunblock on 30 minutes before you want to use it, or you want it to be effective. So you really have to let it get in and start to do its job to help protect you from the sun. We recommend that people use a minimum of SPF 15. And for folks that, we all learn about SPF, it's sun protection factor, and that number is the number of multiplications of time that it will protect you from your skin from burning. So if your skin would normally burn in 10 minutes and you use an SPF 15, you figure you have 150 minutes of protection. Doesn't really work out that way. There's a lot of variables.
Like if you're swimming or something like that?
If you're swimming, or depending on where you are, if you're closer to the equator or not, and the intensity of the sun on that day. But it's a rule of thumb. And typically people choose sunblocks between SPF 15 and 50. Okay. Where SPF 15 actually blocks, if you always choose a broad spectrum sunscreen, which blocks both UVA and UVB light. And if you have a broad spectrum sunblock, which virtually everything is these days, SPF 15 will block 93% of those sun rays. SPF 50 blocks 98%. Going above SPF 50 really doesn't have a benefit. So you choose something in the middle, make sure you reapply your sunscreen. We tell people every hour or two you need to reapply the sunscreen, get the kids out of the water, and depending on their activity, how much sweating you're doing or how much swimming you're doing, you may want to change that frequency. But make sure you reapply your sunscreen.
Higher level, my wife is a big fan of using 50 on the kids, right? And not necessarily because they may burn in less speed than I do, but I guess, is it a rule of thumb to usually go with a heavier SPF for younger children, or is that not really, is it not quite that transparent?
Most people adopt that exact practice, and most of us are using the higher level SPFs on the kids. But as long as you stay between 15 or higher, you're gonna have some degree of safety, which is important.
We've talked, and COVID has impacted how much people are able to do in groups and the activities, especially with children, what kids are able to do out in the summertime. But activity is nonetheless occurring. People are going to parks, people are going on walks
Sure,
and things like
sure.
that. But the summertime, especially with some of the high heat and the temperatures that we've had recently, can present some challenges as well. In terms of things like hydration and,
Sure.
and all of that, how important is that to keep in mind?
Critically important to stay hydrated, and we all know that, and we all have a very good idea about the signs of heat stroke we always hear about, or heat exhaustion. Heat exhaustion comes before heat stroke, but everybody has this idea, but it starts much earlier. It starts much earlier in the process with what we've all kind of experienced as with maybe just heat cramps. Or, you know, and you've seen a heat rash sometimes on the children. They're playing so hard and they're on a heat rash. And, you know, the first time I actually saw it, it was my mom that corrected me.
Oh, really?
As a physician or anybody.
See?
Grandmother
Mom knows best.
grandmother of 14, she said, would you get the kid inside, you know, and you take off the clothing and then cool and the heat rash goes away. So it's something to be mindful of. We've all had heat cramps before. You typically get them in the legs, and
Yeah.
sometimes you get that little bit of swelling in the legs, and you have to get cool. There's some competing theories about it now. It used to be a hydration theory. Now there's a different theory around a neuromuscular theory. In the end, cooling down, hydrating, and just cooling down your core temperature is the key to this. And for the kids that are out practicing and running, you have to stay hydrated and you have to take some breaks. Make sure that your core temperature doesn't go up. When you hit the dangerous levels, if you're around some people and they seem like they're getting disoriented, that's a very big problem. They need to immediately get cooled.
What about, you know, I think that everybody right now is sort of trying to figure out which activities are the ones that are most socially responsible in light of everything that's
Sure.
going on.
Sure.
But ultimately, if we're all in agreement that social distancing is going to be sort of at the key of making sure that we're able to keep the numbers of COVID-19 transmissions down, people are going to look for activities that may get them away from other people, or
Sure.
things out in the woods or more rural.
Sure.
What about ticks, insect
Sure,
bites, things
sure.
along those lines? How important are those? What can you do really to protect
Absolutely. You know, we're seeing a lot of people going on hikes. A lot of people are getting out and they think, you know, this is a great activity. It's a great exercise, and we have to keep up on our exercise. And maybe later we'll talk about preventing illness, which remains to be important. But a lot of people getting out into the woods. And so the thing to use going out there are some natural, more natural remedies. Some people use lemon, eucalyptus. It has been shown to be effective, but nothing is more effective than a substance that controls DEET. It is DEET, D-E-E-T. And this is safe for children as young as 2 months old.
Oh, good.
And so it's good for everybody. And the recommendation is that you put it on exposed areas. It's okay to put it on clothes.
Okay.
You can put it on exposed skin once per day. And do not put it on the hands, especially of children.
Why not?
Well, you don't want, a lot of times we touch our face.
Okay.
And you don't want to ingest it, you don't want to get it in
Rub
your
your
eyes. We
eyes,
don't
right.
put it on the face, we don't put it on hands, and tremendously effective. And you know, a mainstay of avoiding tick-related illness is to avoid the ticks. And this is the best.
Easiest way to avoid
It's
that.
the easiest solution. You know, so that's the best way.
Excellent. We can come back to some more of those in a little bit, but I want to make sure we address something that we talked a little about in some of the information we shared with our audience to let them know that we were going to be having this conversation today. And that really is about this concept of family medicine, the importance of it, and really its position in what we are all dealing with now as we look to maintain our wellness and our health in the era of coexisting with COVID. So I want to start first with the value of a family medicine physician
Sure.
for individuals, and define, if you will, sort of the family medicine physician's role in the wellness of the family unit. How do you define that?
Sure thing. And so, you know, one of the most compelling reasons I went into family medicine is not only that I get to see people of all ages, and I love taking care of children and older folks, and but a lot of times I get the benefit of developing a long-term relationship with a patient. And so I get to know them, I get to know their family, I get to know the people with whom they're friends, if I'm lucky enough to meet those people as well. So you understand a lot about a person that is more than just their biologic need. You understand their social structure. A lot of times you understand from other members of the family the impact that their relationships have on them. And so we bring this all to bear on their care. And so we can understand when they present a problem how it is really part of their whole life, where it is with where they work and with whom they enjoy. And so we use this to help prevent disease and to also help treat an acute or chronic illness. What we're finding over the past few months, and it's been a difficult time for everybody, but what we found over the past few months, it's getting better now. But in the beginning, a lot of people with chronic disease, they were scared to go out of their house, and I don't blame them. You know, but now we have stressed the importance of returning to your care. Return to the care of your chronic disease. Do not let your problems lapse, your attention to your problems lapse, that is. And make sure that we prevent future disease. And we can do that. We safely return to your providers now. And I should say that family medicine isn't the only discipline that do this. People also get this from other medical subspecialties, especially general internists and pediatricians have a similar way about us.
What has been, and we've talked about this in some other applications, but I think it's important to reinforce, and especially for those viewers who may be joining us for the first time, what are we doing at a practice-based level to make sure that when people do return to their care, that it's being done so safely?
It's amazing the transformation that's gone on in healthcare in such a short time. It was, you know, of the benefits, a benefit that has happened is really allowed us to really care for people in different venues. And in the office in particular, the complete workflow has changed. So people now come in for their appointments, remain in their cars, and they give a call and say, we're here. They've already been screened to make sure that they're appropriate and safe to come into the office. As they come into the office, into the building, their temperature is checked, they're screened again, they come straight into the exam room. So there's no waiting in the waiting room, there is no waiting room. There's no get your attention in the exam room and then you are sent home. There's no waiting on the outside either, and so you go right in. So the time that we have minimized the time that you would actually cross past a person, and so this lets us observe our mitigation strategies of social distancing and not being around other folks, mask wearing. So we've really buttoned it up very nicely.
When we talk about return to care, and what are some of the things that folks probably should have come to see you by now to talk about, but maybe they didn't want to, or I mean, and perhaps maybe it's not them, maybe it's their kids, or their,
Sure.
Or what are some of the things that people have been coming back into the office to have done, and if they're not, and if they're putting them off, what do you want people to come back in to have looked at?
Sure. Well, you know, the first group of people that we think of usually are the people with chronic disease for which they take a medication on a daily basis or on a routine basis. And so, and some of those are you can prioritize them at different levels. Some are more important than others, but the most common ones that we think about, we hear all the time, are things like hypertension, high blood pressure, or high cholesterol, hyperlipidemia, diabetes. We hear these all the time, and people who take chronic medications, they need their labs reviewed. These folks are the people that we've encouraged to come in, and you know, a lot of the providers' offices have gone and reached out and said,
sure.
and say, hey, listen, how are you doing? And you know, and it's time, and I think one of the things that has been very powerful is having the conversations with patients and explaining how we can do this safely. That we've had a purposeful and direct, a real effort to make sure that we can do this in a safe manner and take good care of our patients.
One of the things you and I chatted about in the past, and I think was sort of a useful analogy for me in helping orient my thinking around the value of family medicine, and having a relationship, a long-term relationship with a family doctor, was this idea of, you know, when people think about their finances, they think about, you know, how do I plan for retirement? How do I cast out and look ahead for the next 20 or 30 years of my financial life? But it strikes me that some of the work that you do with folks, especially if they come into your care at a very young age, is very similar. Can you talk a little bit about how that works and what people need to know about these kinds of medical relationships?
Yeah, we sure can. Well, one of the benefits of this is as you go on through your preventive services, you know, and one of the conversations that typically occurs in one of the offices in one of these visits is you say, listen, we have to get you a 30-year plan. A 30-year plan for health, a 40-year plan, and how does this look? Your X age and fill in the blank. How does this look 40 years from now? And how do we manage your conditions now? What investments, to use your metaphor, what investments do we need to make now in your health so that you have a 40-year plan where you can enjoy your life, you know, to what extent that you want to do it. And we define those goals individually. And this is where the relationship with the patient becomes most powerful, because you really help to decide, hey, listen, what do you want? What are your goals? What are your goals for care? What are your goals for your life? What would you like to see? And it becomes a very powerful motivator for patients. This gets people, they get healthier, they exercise. They follow proper nutrition, although it's a little harder in the summer.
Yeah.
We all know it's a
Who
little
doesn't
harder.
love a good cooking? Right?
It's a little harder in the summer. People think, oh, it's summer, I'll lose weight. It's a little harder in the summer. You go to a cookout, you have something maybe you don't usually have.
Yeah. Indulge a little
That's
bit,
right. That's right.
Let's pivot a little bit to how family medicine has been practiced during the era of COVID-19. How different have the last few months been for you? Obviously, we just touched a little bit on how practices and the functionality of the practices have been different, but what have the last few months been like for you personally in terms of the medicine you practice and the patients you have relationships with?
No, thank you for that question. You know, in all honesty, I've shared this with a number of people, and you know, the time between the second week of March and probably the third week of April, I don't think I ever worked harder in my life. It was you know, we found ourselves, as did many providers, you know, receiving a whole lot of phone calls and a whole lot of concern, rightfully so, of people that we have relationships with, that we care about.
Yeah.
And they wanted to talk to their doctor.
What did they say
And
to
their
you when they
provider.
called?
Well, they were, most of the time people were just worried. They wanted to know about how to mitigate and reduce their risk of getting infected, and what happens and what should I do. Different people had different concerns, you know, specific to their health-related illness.
Mm-hmm.
You know, and it's a little difficult. It was difficult of a time, as you know, as everyone knows, that, you know, the information was still coming in.
Sure.
And you make the best judgment that you can with the information at hand. And, you know, pretty much with everybody, I said, let's talk again in a week or two, because this is going to change.
Right.
We're going to continue to think about this. But I'll say this much, having those relationships has really permitted all of us, all of the primary care physicians and providers, to have such a great impact with people, because one of the things that transformed overnight, within 2 days, was the ability to use video visits, you know, virtual visits,
Yep.
video, telephone. And you know, there was just a group of providers who just said, give me anything, any way to get in touch with my patients.
Mm-hmm.
And so we took advantage of that. And but what was most important is I could tell you how much of a difference it made to me that I know these patients for years. Now
Okay.
seeing them on Zoom or Skype or FaceTime, whatever we use, seeing them, I already knew. I've done their physical exam. I know what those lungs sound like. I know what their voice sounds like. I know if there's a difference. And there is a tremendous difference in that visit than seeing some people de novo, which we also saw.
Mm.
You know, but there is a powerful difference between that person that we had the long-term relationship with and the person that we were just meeting.
It's an important lesson for folks who may be deciding how do I select or do I need to select a primary care physician, or can I just kind of handle this in a one-off setting? That shows the timelessness, the idea of this broad idea that what affects you right now may not necessarily be what affects you in 6 months, and the value, or in 6 years rather.
Sure.
And having that relationship is an important thing. If you're interested in learning more about the virtual visit system here at Atlantic Health System, you can go to our website and you can find additional information there, as well as finding a physician, right? If somebody needs a family care doctor and wants to select one, what are some of the things you advise them to ask the physician? How do you build a relationship? I know it's tough to
Sure thing.
consolidate into a one-answer thing. Tell me about your career in 60 seconds. But how do patients build those kinds of relationships?
Sure thing. Well, you know, the first thing, most people turn to the internet at first, and they take a look for reviews, or they take a look for somebody that maybe they got a recommendation from a family member or a friend. Those are most of the time how people first identify them. Then have a visit.
And those conversations, what would you recommend people, if somebody came into your office and was trying to figure out whether or not Dr. Zipp is the doctor for them, what types of conversations do you think would occur?
Sure. Well, you know, the first thing is people typically talk about the patient will, you know, express a need that they have.
Sure.
they'll express, and their personal philosophy that they share.
Mhm.
They share, and some people may be very, I've been doing this a while, so I've seen a bunch. And some people are very interested in, listen, I've chosen the lifestyle that I want to lead. I'm not going to exercise. Just give me a pill.
Help me navigate.
And that's fine. And there's some people that say, I want to avoid medications as much. Can you help give me an exercise prescription? Well, sure, and you have to, you really just have to have the conversation with someone and understand, hey, does my personal philosophy match that of this provider? And it's okay to look around. It's okay to shop.
Sure. Find a Doctor is at atlantichealth.org. You can find it right at the top, so you can click up there, and you'll have an entire list of Atlantic Medical Group physicians, just like Dr. Zipp here, who can help you navigate and create that 20, 30-year roadmap for your well-being. Let's pivot a little bit to COVID, because I know that we have some questions that have come in about that specifically. And much like where we were several months ago, and I think a lot of the questions you were getting were, what do we know about this disease? There's sort of a new round of that, right? Because as people are getting back to activity, pools, for example, all
Sure.
that kind of stuff, they want to know how to engage in those in activities like that safely. Some folks travel, right, as part of their regimen. Have you taken questions from folks who have said, look, annually we go south for the summer, or wherever it may be, a beach community, something along those lines? How do I do that safely? Are you getting questions like that?
Yes.
From folks?
We're again, of late we're getting many questions regarding this. As we've all kind of get a book of knowledge that we have now of COVID and of what we know to expect and to look out for about the common symptoms that we talk about. We all understand our risk, our mitigation strategies. Wear your mask, remain socially distanced, wash your hands, don't touch your face. And so we've heard this over and over. We're becoming, I don't want to say comfortable with it, but it's in our knowledge base.
Yeah.
Right. And so now, as we consider how do we return our life back to normal, we're creating a tension point, because we want to go on that vacation and we want to go to the pool, and so we're getting
or
some
have the grandkids in from out of town.
Yes, that's right. And we're getting some guidance from our government about, look, there are some hot spots.
Yeah.
There are some hot spots, and this is not over, and this is a marathon.
Arizona,
Mhm.
North Carolina, Texas, places like that.
And
Yeah.
so we have to be smart and listen to that guidance and say, look, it's okay, but you have to individualize it. You have to take into consideration, the individual grandma and grandpa, or might be in the Carolinas or one of the hot spots, want to come up and visit. Can you do that and meet the current guidelines? Can you say, okay, we're going to quarantine for 14 days.
Right.
We're going to remain so. Can I go to the pool
Right.
and remain socially distant?
Right.
Can I go on the hike and remain socially distanced? Can I wear my mask?
Right.
Can I have a smaller group of people who I know have behaved similar to me? They've been in lockdown. They've remained socially distant and vigilant. Can I have a couple of those people outside in the backyard and have a barbecue and remain safe? And so we see a lot of people starting to have these activities. And the key to it is to heed the guidance.
Yeah.
Heed the guidance, mitigate the disease. It's not over yet.
Right, which I think is an important thing to reiterate, because I think a lot of folks, to your point, are ready to get back to a more normal arrangement. But we see what's happening in other states, and I think if we don't, is it one of those things where complacency is the enemy? I mean, if we stick to the public health guidelines, is it the kind of thing where we can try to avoid what we're seeing in other states? I mean, are you encouraging folks, look, to kind of avoid the pools, avoid, those things entirely?
No, I think you could. I think you could still safely have fun.
Yeah.
I think you can get to the pools. I think we have to be smart about it, and we have to. There has to be
No
a
lining
blend.
up at the diving board,
No,
right,
no
back to
line-
back, front to back, back.
No
all
lining
around-
up at the
around
diving
pool.
board. That's
Yeah.
right. I know it's hard. I know it's hard, but no lining up at the diving board, just like you wouldn't line up anywhere else.
Right.
So that's how. I know it's hard, but we can safely get back to some of it.
Excellent. So, Dr. Zipp, we've got just a couple of moments left. So, in terms of how folks are setting themselves up for wellness, we talked a little bit about activity, and I want to leave with a concept with some more of those summer concerns that we told folks about. Are are there just some good rules of thumb to maintain, just in case you're joining us late, regarding skin care, heat concerns, proper nutrition? We touched on that on that as well, and activity. Best to sort of keep those same lessons you've learned from summers past and just kind of stick with those right now. The best long-term advice is the ones that have always kind of been in place, right?
Yeah, it seems that that an ounce of prevention is worth a pound of cure, right?
Sure.
And so if we make sure that you try to prevent, and not only just prevent the spread of COVID and you getting COVID, but just to prevent, you know, disease in yourself in general. So proper nutrition, getting your exercise, getting your sleep.
Okay.
Most people don't sleep enough. You need a proper amount of sleep. And so what we're finding is if you make sure you exercise, build your strength and endurance, your flexibility, your hydration, you know, you have the foundation of success. And the remainder, wear your mask and stay away from people, is a special bonus for this year.
An added value. Yes.
Added bonus this year. So, but I think if we put those in, get your rest, and put those in as our tenets, it will give us a good beginning of a preventive plan. See your doctor. Get a doctor.
I got one right next to me if you're looking for one.
Get a doctor. See your doctor. Know your numbers. Know what is my risk. What risk is conferred to me by my genetics, by my family, and what's conferred to me by my lifestyle, by the choices I make. Understand your risk and go into your 30, 40, 50-year plan wide-eyed and with knowledge, and make an informed decision about how you want to live your life.
Dr. Christopher Zipp, thank you so much for joining us today.
Thank you, Luke. Appreciate it.
All right, folks. So if you missed any portion of our discussion right now, we have a couple of ways that you can catch the entire thing. Of course, the Facebook thread, which is where it'll live. So if you miss any portion of it, you can click down below. Check it out on LinkedIn. You can also go to our YouTube channel where you can find this community conversation and all the other ones we've done previously. And of course, AtlanticHealth.org, which is a place where you can find a number of the resources Dr. Zipp has talked about today, ranging from Find a Doctor to our virtual visit and all of our community conversations. And of course, you can check us out this weekend on News 12 Plus, 8:30 in the morning on Saturdays and Sundays. So to my guest, Dr. Christopher Zipp, thank you so much again, sir.
Thank you, Luke.
All right, folks, thanks for joining us today, and we will see you next time.